This week on the BackTable podcast.
76% of general surgery residents had significant or severe imposter syndrome. So really quite common amongst surgeons. And as we've been talking about, imposter syndrome doesn't necessarily go away. I know even looking at when we did our internal survey of our faculty and residents at UCSF, one of the surprising findings was that imposter syndrome was equally as high among our current faculty as it is residents. And so it just shows that it can be sort of this pervasive trend, throughout different times in your career.
Hey everyone, welcome back to BackTable Podcast. This is our chance to focus on education issues and specifically target our urology trainees. I'm Lindsay Hampson and I'm missing Gina today, but I'm really excited to have a guest with me, my friend and colleague at UCSF, Michelle Van Kuiken. So Michelle, I'll let you just introduce yourself and tell us a little bit about who you are and why you're here to talk about imposter syndrome.
Yeah, so thanks, Lindsay. I'm Michelle Van Kuiken. I am an assistant professor of urology at UCSF, and I serve as the associate residency program director alongside my esteemed program director, Dr. Lindsay Hampson here. And this is just a topic that's been, I think, of interest to myself and a lot of people in kind of our circles these days. I think it's a highly, popular topic that we continue to come back to. And even thinking about, being invited to be a guest on the Imposter Syndrome podcast, you think am I qualified to talk about this topic? Or should I feel like an imposter because I've been invited to talk about imposter syndrome? And then you realize for all those reasons, you're probably qualified to talk about imposter syndrome. So I think excited to be here today.
Yeah, awesome. Well, I think imposter syndrome is something that's been kind of talked about maybe more recently. Some people may not still have heard about it or know what it is. So why don't we start with the basics? Talk to us a little bit about what imposter syndrome is, and specifically for, trainees like residents, how do you see it manifesting?
Yeah, so imposter syndrome is this kind of pervasive idea of self-doubt or the fear of being found out. And the term was originally coined in 1978 by Pauline Rose Clance and Suzanne Imes. And it was originally used to describe high-achieving women, but we now know that imposter syndrome is inclusive of all genders. And really how, we see it present, I think, in a lot of us, and particularly in our residents, is people can tend to be really overly self-critical. There can be traits of perfectionism and sometimes can even lead to overwork. So this idea that everything you're doing is, just constantly not meeting metrics or standards. And ultimately, this can lead to burnout, which is another, hot, popular topic that we talk about recently, where it's like that idea that you're constantly striving, but maybe not, accomplishing the things that you want. Conversely, we can sometimes see it leading to avoiding responsibilities or opportunities due to fear of risk or fear of failure, which can also be, a negative impact. And also it can make people really highly sensitive to feedback. And, sometimes that feedback is what we need to help grow and improve. But when you're constantly feeling like an imposter, that feedback may feel really difficult to take in and learn from.
Yeah, I think that goes to this growth mindset of thinking about feedback as a good thing. But so often we've been these very driven type A people to get to this role that feedback can sometimes feel like a failure. So
Right.
I'm interested, do you have an example of a time when you felt imposter syndrome as a resident?
I mean, I think it's hard to pinpoint just one time, but I remember, even just getting up to present in front of the department at times, or even presenting things at M&M, and you feel so humbled by the difficult challenges that you face. And I remember one instance in particular, there had been a pretty adverse outcome for a patient, and I, as the chief resident, had to get up and, discuss this complication and felt just really overwhelmed by it and felt like, with what had happened, do I deserve to be here? What qualifies me to talk about this? And I don't know. And it's weird how it just kind of creeps up to you in these kind of weird, unexpected times. And, I felt really, overwhelmed in that instance. And I think it can happen to people at, various points and times.
Yeah, thinking back for myself, we all have and continue to have imposter syndrome. And I remember as a resident, you'd show up to a case and you'd tell the attending like, hey, I've done this before, this is what I want to work on. And I would show up to cases and tell attendings that I had never done the case before, even if I had, because I was worried about what expectations they would have for me. And I was only hurting myself, right? Like at the end of the day, I was only taking away opportunities for myself by doing it. But it was this way of like making sure that people didn't think that I knew more than I did, and it's so interesting how it manifests, and in that way also how it holds you back, because I think of, the opportunities I took away from myself just by having that kind of doubt that crept in. And I also remember it was a few years ago now at the Society of Women in Urology meeting. We were kind of talking about imposter syndrome, and there was a Q&A session. And I remember Isla Skinner getting up to the microphone and saying like, well, I have imposter syndrome. And I was like, oh my gosh, how can Isla Skinner have imposter syndrome? Like she's amazing. That's crazy. And I think it just like made me really realize that, it doesn't ever go away. And for that reason, I think it's really good to recognize it when you're in training, because it's something that you're going to have to figure out and deal with through your whole career.
Yeah, I remember maybe you and I are in the same talk and hearing Isla say that, and you're like, what? Like one of the most accomplished and like highly respected women in urology is saying that. And I mean, we've also heard a number of, prominent men in the field talk about it as well. And I think it always is that reminder that I think one of the questions is like, does imposter syndrome ever, go away or resolve? And I think clearly the answer is no. But I think in some ways, like having that little bit of imposter syndrome is good, right? Because like kind of the flip side of it is that, even in these people who are so highly accomplished, I think it also gives you that like little bit of like fire or spark to like, keep improving and keep achieving. And so it's like that healthy balance of like motivation. So maybe no longer imposter syndrome per se, but like it helps to provide that intrinsic sense of motivation to keep building and growing.
Yeah, I think that's true. I mean, I do think a little imposter syndrome is good, both to kind of keep your drive up and also to just sometimes you don't know what you don't know.
Right. All the time.
Oh, yeah. And that can be really bad. There's this like, I don't know if you've ever seen this graph. It's called the Dunning-Kruger effect. And it basically is like, there's like confidence on the y-axis from low to high. And then there's competence, how well you can do something, on the x-axis, like know nothing to expert. And there's this like problem that can happen, especially in like really junior trainees, where like you don't know anything, but you have a lot of confidence because you just don't know what you don't know. So in that way, yeah, I do think it's a good thing, as you're beginning to have, a sense of knowing that you might need to ask for help, and that's okay. But even as you go on, to know like what your strengths, what your weaknesses are, and have it be something that pushes you. Do we have data on how much imposter syndrome affects, us in medicine?
So we know that it's pretty common. There's not a lot of data specific to urology, but we know that imposter syndrome and burnout among medical students and residents is pretty common. There was one study that from the Journal of American College of Surgeons, it showed that 76% of general surgery residents had significant or severe imposter syndrome. So really quite common amongst surgeons. And as we've kind of found out, as we've been talking about, imposter syndrome doesn't necessarily go away. I know even looking at when we did our internal survey of our faculty and residents at UCSF, one of the surprising findings was that, imposter syndrome was equally as high among our, current faculty as it is residents. And so it just shows that it can be sort of this pervasive trend, throughout different times in your career.
Yeah, it's interesting. I was looking at this article that was the plastic surgery article that was looking at imposter syndrome in both men and women and faculty kind of across the time span. And they looked at assistant professors, associate professors, and full professors. And when you look at imposter syndrome and the prevalence and presence over time, it actually doesn't change. And I think
so
that's
interesting.
Yeah, it's so interesting. And we all probably think when we look at those people that are senior to us or that we think of as, wiser, that it goes away, but it really doesn't, which I think in the end then causes us to think about, well, how do we overcome it? What do we do? What strategies can we employ to kind of, prevent ourselves from being held back from imposter syndrome?
Yeah. So I think, some of the strategies that I always think about and I think have worked well are thinking about, we're always the most hypercritical of ourselves. Our failures always are so much bigger to us than they usually are to other people. And I think really trying to view yourself, sometimes through the lens of others, which, asking yourself, like if you had a friend or colleague, in a similar situation who did what you did or made the mistake you made or was, whatever the example is, like what would you say to them? What is the advice you'd give that friend or colleague? And chances are like that's not going to be nearly as, hypercritical as what you're telling yourself or what you were thinking. So really like how would you talk to others, I think is a good strategy. I think reflection, I think a lot of us who are really busy and highly accomplished don't always take enough time to actually stop and reflect on all of the things that we're doing. And whether that's even just taking, I think different people do this at different time intervals, but, whether it's, once a week or once a month, just really like taking a time to, some people use journaling or logging, just thinking about the things that you've actually accomplished, whether that's in, patient care, leadership, education, just something you've learned or grown or gained. I think we don't think enough about all of the great things that we're actually doing and accomplishing because we're not mentally logging them or thinking about them actively. And a lot of people tend to focus on the things that they're doing negatively. So I think that self-reflection can be a really powerful tool, however you choose to utilize it. I know sometimes like what I'll go through and I'm like, like feeling really down and I'll sit and think about, when we're updating the things that we've accomplished over the past few months. And it's like, I actually like have really done a lot. I should feel good about this. And oftentimes that can be really helpful.
Yeah. And I think along those lines too, like thinking about reframing the narrative, like you were mentioning before, is super helpful. Sometimes you need a friend to help you do that. Sometimes it's like writing something down or telling a family member, just to think about things differently. So many people probably in residency feel like they approach so many situations and have no idea what they're doing. And instead of feeling like I have no idea what I'm doing, to instead reframe it in your mind, wow, this is so cool. I'm learning something new. It's normal not to know everything, right? Or thinking about asking for help, where often I think residents think, if I ask for help, it means I'm not good enough, or I don't know how to do something, or somebody's going to think poorly of me. And instead, you reframe that narrative to think, okay, asking for help is how I grow and improve. I can't get better unless I ask for help. So I do think there's like really ways to reframe the narrative that helps to kind of get away from those negative associations that we have with that self-doubt when it creeps in.
And I think the kind of converse of that is true. I think, one of the things is how do you be a good mentor for someone who's dealing with imposter syndrome? And I think kind of the reverse of what you're saying is also true. I think, as were discussing, people throughout stages of their career and in these high leadership positions are often still dealing with imposter syndrome and some of these feelings. But part of the problem is I think up until pretty recently, people didn't really talk about it. So you see these great figures who you kind of hold on these pedestals and realizing that deep down everybody's kind of struggling with these same thoughts and issues. And so, in terms of, talking to others with imposter syndrome, I think one of the great strategies is just to exactly talk about it, be vulnerable, talk about your experiences where you've felt times of self-doubt or where you've struggled with your confidence or mistakes that you've made, I think are really powerful tools to help trainees or colleagues or whoever, feel like, I'm not alone. There are other people that think this way, who have felt this way, who have gone through this. And I think sharing those experiencing that idea of like being vulnerable as a mentor is, I think, really powerful and something I think we're getting better at doing, acknowledging that like, I've made mistakes doesn't make you a weak person. I think it makes you a strong person for being able to talk about it. And I think that paradigm is shifting. And I think that's great for us to embrace that change.
Yeah, I mean, One thing we do for our residents is a near miss conference where we actually have a session every year dedicated to talking about like problems that were averted because somebody spoke up or noticed something, and just the reminder that, you have agency, and also that bad things happen, and it's not necessarily anyone's fault. So like talking about mistakes in general. And I think your point about mentorship is really well taken. There was a study actually among general surgery graduates who had like graduated within the last 4 years, and it showed that they had significantly higher imposter syndrome scores if they didn't have a surgical mentor. And that really speaks to your point of how important mentorship is. And I think, we know that people with mentors are more likely to get promoted and, more likely to have leadership advancement and opportunities. And I mean, we also have been, I think, talking a little bit about gender concordant mentoring and how that might be important too. So I'm interested in your perspectives on that. At the AUA recently, there was a wonderful talk, and, we saw some data around how senior level men are hesitant to spend time with junior women because they're worried about, what it looks like or how it would look. And I think that really limits opportunities. So do we need to be thinking more about that, in mentorship?
Yeah, absolutely. There was the paper that you were the senior author on recently that talked about how women are underrepresented in leadership positions and endowments, and I think a lot of that is likely people attribute it to a pipeline problem often, right? It's like, oh, well, there's just less women. We don't have enough women who have reached the ranks, if you will, to be in these positions. But that's not always the case. I think that's only half the story. And, some of that data that we did see shows that, a lot of times women may, because there are more women in senior positions, may be suffering from that lack of mentorship. And I think there really is an onus to figure out how can we kind of narrow that mentorship gap. There are a lot of great resources that are available online, some of which, Sheryl Sandberg and Lean In have done a lot of work in this space. Dr. W. Brad Johnson, who came and lectured at the AUA SWU session, did a really good job of talking about some of these resources and strategies. So I think we just have to find ways to get people to engage with them and understand that the role of mentorship is really powerful, and, helping people gain confidence, get promoted, do all of those things. So I think it is a continued area of focus that we, need to keep looking at.
Yeah, I mean, as a program director, I really think about this, like, how do we make sure that we put this structure in place in our residency and training programs? And I came across this not in the mentorship realm, but in thinking about what programs we can put in place to help with imposter syndrome. I came across this paper recently that I was really interested in. It talked about the use of this exercise called the best self exercise. I don't know if you've heard of it, but basically what they did is they took a bunch of residents, and before they came into their residency, and they said, okay, go get stories from your friends, family, and colleagues, have them write things down about like why you're so amazing and like, how accomplished you are. And so that you can like remember those, read those, and have them to refer to them afterwards. And they actually found that those students, once they came in as residents, had much lower imposter syndrome scores once they were in residency if they had those. And there were really cool, like qualitative kind of stories that people shared, saying how it was like such a confidence boost prior to starting residency, which is like a really challenging time for a lot of people where you feel really nervous and out of fish out of water. And somebody else said like, oh, they keep them like next to their bed when they're in residency, and like those days where they come home and feel like, wow, I really didn't do my best today, they could look at those and just remember like how they got here, why they're here, that they deserve to be here. I think so often residents feel like, oh, they must have picked me by accident, like I shouldn't really be here. And it's such a common way to feel, and that reminder that like you earned it, you deserve to be here, that you're not going to know everything, and it's okay.
Yeah. But I think that's very awesome. I hadn't heard that before, but I think taking it even a step further, again, going back to like us as mentors and us as educators, as we have opportunities to do some of that too. I think, we have some people are better than others at giving feedback, but I think it's also important to give, praise and positive feedback when it's earned. I think if people are just constantly only hearing about the things they're doing wrong when maybe they're doing, 90% of things well, and we're only focusing on those 10% of things that are going wrong, it can certainly feed into that mechanism. So, making sure, we talk about those like feedback sandwiches where it's like, also talking about something that went well coupled with, a piece of feedback can be a powerful tool. And just also really taking the time, like when someone does a good job, or whether that's in a case, in the clinic, on a research project, whatever it is, like taking the time to acknowledge that hard work that they've put in, the good job that's been done, I think really just goes a long way. Something really simple like that, I think can help people feel more comfortable, in their role.
Yeah, and it's true. Like those little things, those shout outs actually make a big difference because as a resident in particular, I think you do so many things in your day to day. And it's nice to have recognition when you've done something well. And we probably don't give enough of that. Too often you get called because you do something not well. And,
Right. You're like get called in because something went poorly, but it's like, but not most of the time,
exactly.
you're actually doing a really good job.
Right. Most of the time you're doing great, which is why you're not hearing from your program director, but
Right.
yeah, it is good to celebrate the small wins. And I actually think your point about feedback is a really good one. One of the recent kind of faculty educator groups at UCSF put out a little 3-minute clip on, how to give feedback. And I really like their metric for it. I think the feedback sandwich sometimes leaves people with either seeing the feedback as really kind of seeing the positives as really trite because like, oh, somebody was just trying to pick something to put on either side of the negative feedback, or they actually like don't hear the feedback very well because they're just left. They start with a positive impression. They're left with the positive impression. So I like this concept of the start, stop, and keep. And I think it's like a really nice way to do it. Keep is really like, keep doing this. It's really working. It's helping you. You're doing it well. Stop is something that's like a behavior that's not serving you. And start is something that you're not doing yet, but could be. And I think that's a really nice kind of mindset to have when giving feedback. And I would say also, I think receiving feedback is hard, as we kind of alluded to before. It can feel like failure to get feedback, but remembering that every piece of feedback makes you better and stronger and, gives you more opportunity to grow is really important.
Yeah, I think, I am personally someone I think that struggles with feedback, and I always internalize it as like, oh, if you've done something really wrong, or this person who's giving me the feedback doesn't like me. I mean, it's, you go through this like doom spiral but realizing that there are a lot of people, and this goes for all of our trainees, like people, and one thing I've started to realize more as I've gone along is like people actually want you to succeed. And I think, there's a lot of mechanisms in place where it's like, we want our trainees to do well. I want my colleagues to do well. And I think most of the people that are in your orbit actually genuinely want you to be a good physician, good surgeon, good researcher, good colleague. And I think when you go with that frame of mindset, realizing, okay, I'm here to succeed, and most people around me probably want the same, I think it changes your viewpoint a little bit when you get that feedback. It's like, okay, this is a person who, maybe you don't think that all the time, but the truth is like, we actually want, all of our trainees to succeed. I want my colleagues to succeed. And so reframing, I think, can be really important in that setting.
Yeah, that's true. I try to often when I give feedback, I try to remind people I'm giving you this feedback because I actually think that you can do better. Like, I wouldn't give you the feedback if I didn't think you could improve and be better than you are now. So it's helpful to have it in that context. I'm wondering, thinking about we're approaching a new year, academic year, which means we have like med students who are coming in to be residents ascending to new roles. What advice, would you give to people as they take on a new role, which may feel daunting in terms of how do they think about imposter syndrome? How do they, A, recognize it? And what would you tell them, B, to kind of do as they approach this, new year?
Yeah. So thinking about how you recognize it is that feeling of, I don't belong here. I don't deserve to be here. I'm doing worse than my peers. Kind of that thinking, I think, is very classic imposter syndrome, where somebody's going to figure out like that I shouldn't be here.
Yeah, that
And
I got lucky.
like, oh, I don't deserve, they got it wrong. But something, I think you mentioned this already, is remembering if you've made it this far, like you've graduated medical school, you've gotten into residency, like you've already done a lot to be where you are. So remember, like, it takes a lot of work and effort on your part to be where you are. And remember, like, so to that point, like, you deserve to be where you are. And the one thing I touched on was that people, for the most part, I mean, there are exceptions to this, like, want you to succeed. Like, people, you got to this far and people are invested in your success, and you're not going to let people down by making mistakes sometimes or like not doing things perfectly. Like, people want you to succeed. And I think, again, remembering that and always having that is like in the back of your mind, I think is really important. And I think another thing is remembering it's okay to be vulnerable, ask for help, and to reach out if you're struggling, because you're not alone. There are a lot of other people who feel this way. There are a lot of resources available to you. And I think if, whether you feel like you need to reach out to your mentor, even to the support of your peers, talking with somebody else, you're probably going to find out really quickly that you're not alone, not the only person that feels this way. And if you're really struggling, and that's the time when you probably should reach out, to your program director or mentor really for that additional support.
Yeah. And I think the other thing I would add is, find a friend, have a friend that you can talk to. I remember being an intern and feeling like, what did I just get myself into? And being able to call,
Exactly.
My friends, my co-residents, to say like, wow, I really feel like I messed up, or I really didn't know what I was doing, and have that be validated is really
Yeah.
helpful. I know there's some institutions have talked about or established peer support networks and peer support training. Can you talk a little bit about that?
Yeah. So, peer support is obviously, as you mentioned, extremely beneficial. And I think the first place that most trainees, do turn when, or even, now my compatriots are who I turn to when I have a struggle. And I think it's, particularly important for people who may, a lot of trainees are training in environments where they're living maybe, far away from, friends and family. So I think establishing those relationships early is important. And I think, the development of a lot of these peer support programs is just sort of a reflection of that, like acknowledging that having, people at your same level to talk to, as opposed to someone who's more senior, who you might feel like there's a power dynamic, or, might actually increase your feelings of that imposter syndrome, having to talk to somebody who may make you feel intimidated. Instead, you have this option of talking to a peer. At UCSF, there's peer support groups for things like dealing with complications or just, traumatic, stressful events that can, happen, in our healthcare workplace. And I think having those resources is, really, really needed, and I think really timely.
Yeah, I think that's true. I think the more we can develop people as peer supporters, the better we're all going to be at the end of the day. Don't you want to be surrounded by colleagues who all know how to, support their peers and work in an environment where, we're all there to help support and cheer on, our friends and colleagues.
Yeah, exactly. And I think it goes back to that idea. It's like if you have people that want to support you and like that community, and I think building that in with the peer support groups is helpful. But I think it also goes to show, like, we as, in our departments, also providing that space for our own residents and trainees to foster those relationships is really important. So I think, I know our program and many others do create time and space to support the development of those relationships and fostering them. And I think that's a great thing to do.
Yeah, I mean, it's interesting because yours and my journey on imposter syndrome really started with hosting a journal club for our residents, because you and I were both kind of interested in the topic and thought, oh, this would be a great topic. And it actually blew me out of the water, like how much people were engaged and wanted to talk about this, and how much people got out of the discussion. Even junior residents hearing the senior residents' perspectives was so valuable. And, we showed some data from our own department showing how imposter syndrome was present in all of our faculty, even though they're, amazing, world-renowned faculty. They all, everyone still had some level of imposter syndrome. And so I think also, to your point, programs making space for that, whether it's a didactic session where you really get to talk about it, or it's a journal club where you look at some articles around it, or a mentorship event that's focused around it, is super helpful, because all the data that we see show that by talking about it, you make it better.
Yeah.
So at the end of the day, it feels like, things like this too, right? Just having a podcast about it and acknowledging it, what it is, and that it exists in everyone. At the end of the day, that's really been shown to be the number one thing that can help, is by hearing people's stories and understanding how pervasive it is.
Yeah, agreed. I think that was a really fun and powerful session. And I encourage others to, engage in these similar sessions in their departments, their groups, because it's just a nice way to make space for those conversations.
Yeah, if anyone is ever interested in doing something like that, I know Michelle and I are both happy to, give resources and support and articles for people to make space in their own programs to talk about it. So with that, I guess I'll just ask any last minute kind of words of wisdom or things that you think we didn't touch on that you wanted to make sure we did before we wrap it up.
Yeah, I think we touched on a lot of things, but maybe some of the takeaway points are that imposter syndrome is obviously, very common, and I think affects all of us, and it can kind of ebb and flow at various points in, your career, whether you're a trainee, a fellow, a new faculty, new in your position. And I think I kind of researching this topic, both for our journal club and then also for this discussion, there was this Harvard Business Review that actually did a whole edition on imposter syndrome. And they had this one article that was called, Making Friends with Your Imposter. That idea of, maybe a little bit of imposter syndrome, isn't always bad. You don't want it to be so pervasive that you're questioning, feeling like you're doing everything wrong and you don't belong, but allowing it to be that little bit of motivation to kind of help you, continue to improve, continue to grow, and feel like, what can I or could I be doing better, whether that's for your patients or your trainees or, in your research. It's that little push to kind of keep going. And so I think, we always talk about imposter syndrome like it's, always kind of this negative, but I think there is, turning it on its head a little bit. I think that for us in these kind of high pressure, high performing jobs, I think it actually keeps a little bit of motivation there. And if you keep it in check.
Yeah. Yeah. I love that. I like the idea of making friends with it.
You might as well, if everyone has it, we might as well embrace it and figure out how we can use it to our advantage.
I think that's true. And I think my takeaway from imposter syndrome is I think the important thing is not to let it take over you. So in that sense too, not letting it control you, going back to some data in one of the studies that looked at women's surgeons in practice, actually, they asked about, what kind of impacts imposter syndrome had on their career. And it was really startling to see the results. People reported taking on less complex cases in the operating room, or taking on less time in the operating room, or even giving up operating altogether, or only operating if they, for sure had somebody there who could assist them because they wanted to make sure that it wasn't just on them, not taking on leadership roles because they had doubt about themselves. So I feel like one of my big messages about it is just that if you let it, it can really negatively impact your whole career and your trajectory. And so the goal is not to let it. So make it your friend.
Make it your friend. At least my strategy, or at least tries to be my strategy,
Awesome. Well, thank you so much for taking the time to talk with me today. Hopefully, we've left people a little more knowledgeable about what imposter syndrome is and some strategies to deal with it, both from a programmatic level and on an individual level. And look forward to talking about this kind of issue more. So join us for our next BackTable Urology podcast. We'll look forward to being back soon.
All right. Well, thanks so much for having me.
Thank you so much for listening. If you haven't already, make sure to subscribe, rate the podcast 5 stars, and share with a friend. If you have any questions or comments, DM us at _BackTable Euro on Instagram, LinkedIn, or X. BackTable is hosted by myself, Ruchika Talwar,
Jose Silva,
and Suzette Sutherland.
Our audio team is led by Kieran Gannon, with support from
Aaron Bowles,
Gabe DeGrazio,
and Josh Spencer.
Design and digital marketing led by Brian Schmitz.
Social media and PR by Chi Ding.
Administrative support provided by Judy Dela Cruz.
Thanks again for listening and see you next week.